Are you going to say you're deteriorated, you're degenerated? And finally, the patient, after you give them every explanation you have about their x-ray and all the things that are going wrong, the patient looks at you and desperately says, but doctor, do you think you can help me? Now, what are you going to say? My dad's words, many seemingly impossible cases have responded to chiropractic care. I'll tell you this, Mrs. Jones, I will try. Try to help you. Will you really try? Yes, I will try to help you. What have you turned on? Hope. There's an old French proverb that says the presence of the doctor is the first part of the cure. Will you be that doctor? Will you present yourself with confidence, knowing what your science can offer, so that the patient can feel it? It's that presence right there that begins the healing process. I know some surgeons who should not even be allowed to cut red and have successful practices. Okay? Why? In the past century, the medical doctors bled them, give them belladonna, mercury compounds, all types of stuff. Awful remedies. Did they have practices? Yes. Why? They had confidence in their methods, regardless if they were wrong. Healers lacking confidence in their own methods are unlikely to achieve the full potential of their methods, knowing as we do. There is so much more to healing than mechanics. Arenas' words, right? What did you before? And to that I say, healers lacking confidence in their own methods will have meager practice. So look at your work, not therapeutically. You're opening up the floodgates of innate expression so the liver can respond once the obstruction to healing has been eliminated. But don't denigrate your position and give all credit to innate, because without your trust, it wouldn't be released. Remember that. Take strong presence in your own ability and give them the adjustment with the extra something, full concentration, x-ray analysis, not thinking about anything else, but putting into that patient that force that will release that innate potential that each and every one of us has. There is a vast difference between treating effects and adjusting the cause. We have been accustomed to the former. The latter was discovered 15 years ago, 1895. He said this in 1910. The latter was discovered 15 years ago and is gradually being developed into a science. A chiropractor is not a therapeutic. That's why I hate that term, spinal manipulative therapy. A chiropractor is not a therapeutic. He is not interested in discovering nor applying remedies. To be versed in therapeutics would be skilled in the use and application of remedies. Chiropractors do not use remedies. Thank you, Doctor. So in one of my lectures, I posed this question: why were the great doctors great? And we certainly have had our share of them in chiropractic, the great chiropractors out there. Needless to say, Dr. Clarence Gonstead, one of the top figures, if not the top figures in the methodology that you all espouse and utilize. But it was their philosophy. Like I said, some surgeons shouldn't be allowed to cut bread. I travel the world of chiropractic. I know many a successful chiropractor I would not let touch me. And I know some who have never been able to build a practice that are excellent judges. So technique does not the doctor make, nor degrees. In the final analysis, it's your patients who will accept you as the doctor. The field of practice graduates the real doctor. Each and every one of you assume that responsibility. And assuming the responsibility, you assume the original meaning of doctor. Doctor means teacher. And again, Bernie Siegel, it is important for the patients to know that their doctors themselves take the advice they give. We must live the sermon, not just deliver it. And your mentor was one of the most positive chiropractors I ever knew. Confidence, supreme. Vaccines did not clean up the country, clean living did. Firm and concise and neat little statements, very much like his mentor, P.J. Palmer. And look at here, for a man who went forth and taught a technique, and you all practice it, so do I. I'm a past master at the knee chest. Remember that chiropractic always works when it does not seem to examine your application, but do not question the principle. Wow. Now, what did he mean? Did it heal everybody you touched? No, 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 no. It always works. If you are correct in your application, it will reduce or correct the subluxation. And then what happens? All else follows. Capacity of the individual determines the response. If you can't correct the subluxation, you better examine your application. Do not question that principle. Let's start referring to each other. My gosh, sometimes I think that we think we got it all. Huh? Come on now, refer to our fellow chiropractors. Maybe you can't deliver a toggle as well as your friend in chiropractic. You can't get the atlas clear. Well, gosh, send them to one who can. Interprofessional referral is, of course, looked upon with great glee. But intra-professional referral is what's really needed in chiropractic. The confidence of Gonstead stood forth in every statement. In my father's statement, he heals most in whom most have confidence. I asked my father, what does it take to become a success in chiropractic? He says, simply keep the patient with you long enough, and the patient will get well sometimes in spite of you. He heals most in whom most have confidence. The man who is right and knows he is right finds no necessity for argument. P.J. Palmer. You don't argue with your patients. If they start arguing with you, pester you about things, tell them to seek another chiropractor. You know what most people say? But doctor, I didn't really mean that. Well, you keep arguing with me every time I talk with you. Maybe it's best you go to something else. Most often they are testing you, because remember this, patients test the doctor's patients. When a patient said, should I come in next week? You know what they want you to say? Yes. That's right. Never make the statement to a patient, if you're not feeling better, come in. Bad. You make your appointment, Mrs. Jones. But doctor, maybe I'll be feeling just fine. Well, that very morning, if you're feeling just fine, I'll allow you to call that very morning and cancel your appointment and have you make one for the following. It shows your compassion. It shows your authority. It shows your confidence in your methods. That you are doing what is right for the patient. This is what the patient wants from their doctor. Let me give you one quick little example. I'm winding down here now. But after being in practice about 5-6 years, I took care of a large, powerful German farmer from the Arcadia region. Now, some of the older chiropractors in this room might remember Dr. Sullivan, who practiced in Arcadia. Deceased a long time ago. Did not believe in X-rays, so he never did one. And he was a brutal adjuster. Very firm. And he passed away. And this